Hello and welcome. I'm Dr. Stone. I've been practicing in Western North Carolina for 25 years. And with all this staying at home, I decided it's time to create a program to help people optimize their health at home and without any extreme diets or exercise programs. In fact, I'm going to show you how to do this pretty damn easy, how to optimize your metabolism, meaning you're looking like your tone and feeling your best. Optimize your mobility, which means moving your best, and your motivation, which is thinking your best, so that we are more focused in life, work, family. We're happier because it's easy to be happy when you feel good. It's easier, and we feel more playful. And the best, easiest way to optimize your health is what I learned in 25 years of practice. And that's what I'm going to share with you here today. I started in chiropractic, studied nutrition, functional medicine, and Eastern medicine. And I want to share the value that I got from each of those practices. And just as a note, the United States is last in the World Health Organization rankings of industrialized countries in infant mortality, lifespan, and chronic disease in middle age, as well as the overall dead last. So there should be no making fun of others. I joined the swimming team in 11th grade, and I came in dead last in section swim meet. And I wasn't getting out of the pool telling other people what idiots they are or how stupid their approach is. And by the way, Japan is number one in Eastern culture. And I'm not sure if traditional Eastern medicine is primary. I do see studies where they're using acupressure in hospital settings. So I know it's at least incorporated into their mainstream. I went to chiropractic because my mom was injured in a fall, and under medical care, she was in bed medicated for about a year. A friend talked her into going to a chiropractor, and in about 3 months, she was back on her feet and working again. So I just chose what was more effective. I didn't know there was this big competition. I thought we were on the same team, working to help people heal, feel better in just different ways. But I did understand that medicine was the mainstream, most prestigious. And so I had to take a look. I got the Merck manual, which is the medical protocol. It lists the conditions, the causes, and the treatment options, A to Z. As I was going through A, I would get to this section called etiology, and it would say unknown. And that is, etiology means what causes this condition. And it was unknown. And they would go on to add that probably related to some lifestyle factors or genetic factors, but we don't exactly know. So it's probably your bad decisions. We can't tell you what they are, or it's your parents' fault, which there's just not much value in blaming our parents. And the fact of the matter is that we all have weaknesses, and we have to learn to live with those. We have to learn how to strengthen and support our weak links. So that left me a little wanting. My wish was some wise woman giving it to me straight. What causes good health? And my goal is to be that wise old woman, or at least that old woman for you. So I graduated, started my chiropractic practice, and I was pretty nervous because I had one resource, and that was the chiropractic adjustment. Thankfully, everyone that came into my clinic needed an adjustment, which was called in chiropractic school, pop and pray. So you make your pop and you hope it works. That was not reliable enough for me as a practice. I moved on pretty quickly, but one natural law stuck from that, and that is move it or lose it. And that is a law we know. We must move our body through full ranges of motion, or you physically degenerate. We know that with a broken arm, we cast that up, we put it in a cast for 6 to 8 weeks, and after we get it off, the nerves and the muscles have atrophied, and we have to rehabilitate to get our strength back. So if you haven't done a deep full squat in 25 years, you're going to have to do some rehabilitation of those muscles to get that full movement back, or you physically degenerate. What I moved on to next was nutrition. That was the easiest to come by. Diet books, I read a ton, and every one of them agreed that we can't be eating junk food. We can't be eating processed foods because it's nutrient deficient. And so we have to choose whole foods on the spectrum of meatitarian to vegetarian. I didn't even know there was such a thing as meatitarian, but in the last year, I've seen people who are promoting just eating meat. Now, you have to decide where you fit, and you should do it by preference. I prefer hamburgers. I like the taste of them. It feels good to me. But the idea of eating only meat sounds repulsive to me. That is not something that I feel drawn to. And that's as easy as diet is we have to figure out what we're drawn to in the world of whole foods. So natural law number 2, you must eat like an adult. Eat whole foods the majority of the time, 80-20. We also have to manage our carbohydrates in proportion with our activity levels. If we have high carb and low activity, we store fat. We know how that works. And if we eat junk food on a continuous basis, the micronutrient deficiency that accumulates in our body results in physical degeneration. It is a choice we have to make. Next, I moved on to functional medicine. I felt like I was getting my questions answered better in studying this. They started everything with what is the root cause? And they had 4 main categories: infections and toxicity, which creates inflammation in our body. Obviously, garbage food could also create inflammation. Stress on all the different levels and how that affects our body and our adrenal glands. And then hormone balance, energy production, and organ health. So how are your kidneys doing? How is your liver doing? And that's what we did. We just tested for inflammation, stress, and all the other factors. And if there was something off, like low testosterone, we might prescribe fenugreek. Fenugreek has been used by bodybuilders for decades to increase their testosterone. And there are randomized clinical trials supporting that. Functional medicine is practiced by all kinds of doctors, MDs, DCs, and Eastern medicine. The president of the Institute of Functional Medicine is an MD, Mark Hyman. His story is that he was living the medical lifestyle, working really long hours and just grabbing food, and he got really sick. And he couldn't figure out what to do with the resources that he had. He couldn't help himself. So he started looking outside the box, and he found functional medicine, got himself back on track, got involved in the community, and eventually, after about 15 years, became the president of the Institute. Functional medicine gave me the 3rd natural law: let the fruit of the trees be thy food, and the leaves thy medicine. And that's a Bible verse, by the way. So we should have probably not been unfaithful about that. And what that means is that if our system weakens or is injured, these are the perfect substances to give strength and repair to our body. Next, I went into Eastern medicine. This goes back to 500 BC, Lao Tzu, who wrote the Tao Te Ching, which in English is interpreted as the way of integrity. He is the person, as far as I understand, that was credited with the yin yang symbol, the health and balance of the masculine and the feminine. His student was Confucius, who is a little bit more popular in our culture. I remember hearing Confucius say, and then a little parable, pretty much all my life. So 3,000 years. No research was being done. They're not doing double-blind studies. There was no harm and there was no conflict of interest. It was one healer passing along information to another healer, and there was no reason to not believe that. There is accumulating research now, given the standards that we live by. And so this was a deeper dive into plants and the perspective of the wisdom of 3,000 years. And it's an interesting story how Eastern medicine got to the United States. It was President Nixon's aide who was in China, and he got appendicitis. And he was rushed to the hospital, and they did the anesthesiology with needles. They didn't give him drugs. And he came back and told his story to our culture, and everybody was like, wow, what's this all about? It was the spark of interest that has brought Eastern medicine into the United States. My personal experience was I had a sinus infection. The pain was so excruciating that I couldn't move my head. And I ran every functional medicine test that I knew about, and I couldn't figure out what was going on. So finally, I went to another doctor, somebody who had more practice than I did. And he diagnosed a mold infection in my sinus, which is kind of gross, but he gave me cat's claw, which is a traditional medicine from South America. And I swear to you, the first dose, I could feel something change. And over the next couple months, things got better and better until everything resolved completely. And that was my introduction to tinctured plant medicines, which is the most traditional form of plant medicine. It bypasses your digestion, so it works on more cases, on more situations than any other medicine. I practice the model of Eastern medicine called 5 elements, which is also known as natural law. So for example, wood creates fire is a natural law. And so if we have inflammation in our body, which is excess fire, we don't add wood. What do we add? We add water. So we're going to do water points to calm down an excess fire. And I had the opportunity to attempt that in my practice. I was told in functional medicine that if anyone with Graves' disease, it was the only condition they mentioned. They said, if Graves' disease comes into your practice, get it out as soon as possible. They're at high risk for heart attack because it's a hypermetabolic. Their thyroid is going too fast. And so they literally vibrate. Like when this lady came in, she was doing finger to nose and her hand was shaking like that. So she comes in, her heart rate is 180. We got the pulse ox on her finger, we're monitoring, and I recognize what she has and I do as I'm told. I tell her that I can't help her with this condition. And she said, I'm not going back to those doctors. I'm not letting them destroy my thyroid, which is what they had offered her as a treatment plan. And if you won't help me, I'll just figure it out myself. So I did my best. And in that first visit, we did Heart 7, which calms the heart down. And I was just trying, like we had the pulse ox on, and I would try this point and see what was happening. And sure enough, it started to go down. And I kept going in that direction, and we got it down to 100. Her heart rate was then 100, which is safe. It's not ideal, but it's safe. We had to do that several times. She came back in and her heart rate was back up, and we did our acupressure and got it to come back down. And eventually it didn't go back up. And so that became natural law number 4, touch. Acupressure, massage, tapping multiplies healing. And it does matter where you touch. In studies, when they're testing this point right here, the placebo point will just be a few inches away, and they'll compare what happens when you hit here compared to when you hit here. And the results are significant. In most cases, most of the studies that I've seen on acupressure have very positive results. For example, I saw a study published from a hospital. It was a post-surgical, they had heart surgery and they were in recovery. And in that ward, they did acupressure on half of the patients, large intestine 4 right there in the web of your thumb. And the other half were given the normal medical care. So they were all given normal medical care, half received this. And in the half that received acupressure, their graded pain was 50% less than the other half of the patients. And the nurses remarked that the patients in this group asked for less medication. So there was more medication use in this group. Their pain was higher on average, and outcomes were much better in the acupressure group. In part, they said, because of the less medication. They had less medication. Medication is hard on your liver and kidneys. And so the outcomes were actually better. That is a good resource. And it's free, and you can do it yourself. So next, we're going to reflect on results. How are we doing? Taking inventory on where are we now? We're going to talk about some stats culturally. How is our country doing on a health level? And then I'm going to give you the details of the complete metabolic tune-up, what your day is going to look like. Coming up next. Hang on. Has age affected your metabolism, mobility, energy, or motivation? Have you eliminated life? Quit jogging, can't play softball, or eat certain foods? Or have you stopped doing anything you once enjoyed because your body can't take it anymore? Do you wish you felt better, moved better, looked better? Do you have a plan to keep your health and body functioning as you get older? Have you become a medical patient? Statistics say that over half of adults have a diagnosed medical condition like high blood pressure, diabetes, thyroid problems, or autoimmune conditions. 78% by the time you are 55. 10 years from retirement, and almost 80% of our population has a medical condition and a medication for life. Are you feeling good about your plan? I'm Dr. Stone, and I do have a plan. I call it a metabolic tune-up, and it's based on the study of success. Successful aging is the study of centenarians and cultures that consistently create centenarians, people who live over 100 years. You might find it interesting that people who live 100 years or more average fewer years of disability than an average American. The average American lives 78 years, the last 11 disabled, unable to do what they used to be able to do. That's 14% of their life disabled. While centenarians average only 5%. 100 years. The last 5, they need some assistance. That means 95 years of complete independence. I'm not promising longevity. I think that's up to you and your creator. Centenarians show us that it is possible to have good health and function while we are here. In America, we have a terrible aging bias. Some say it's worse than any other bias, meaning that more people are prejudiced towards old people than race or religion. People over 50 have to deal with age-negative comments at work, and getting hired when you are over 50 or 60 is nearly impossible unless you want to greet at Walmart. We think of aging as becoming a burden. That's pretty harsh, but it's a reality. What would you do to avoid feeling like a burden to your family? What would you do to make aging a celebration again, like my textbooks describe? The traditional East and native Westerners followed natural laws. Their elderly were revered and celebrated, honored for their wisdom. People would come to them for wisdom and guidance. What would you do to be more like that? Would you let go of blaming aging? Goodness, just the example of turmeric. Turmeric has been shown to improve cognitive decline in randomized clinical trials, a staple spice in India. India has a tenth of the cognitive decline compared to America, which sets the standard at nearly 25% of seniors experiencing cognitive impairment. With regular consumption of turmeric, 1 out of 4 becomes 2 or 3 out of 100. How we care for our health is the problem, not aging. Would you let go of waiting for your doctor to fix you? Would you let go of believing your doctor when he says there is nothing else we can do? That only means that drugs and surgery cannot provide benefit. The problem is, the reason that we aren't happy with the way we look and feel, and we don't look forward to aging, is we gave too much responsibility for our health to our doctor. How am I doing, doc? Right there is a violation of natural law. How you feel is exactly how you are doing. You don't need a doctor to tell you how you're doing. You feel how you are doing. You need a doctor to tell you how to feel and function better. That's the approach of functional medicine and Eastern medicine. If you don't take responsibility for how you feel, you will probably be an average American. Would you embrace natural approaches to health and healing that, like turmeric, are proven to be effective and safe for enhancing your health? So you can feel and look good while you are here, and possibly be a celebrity senior? If pharmaceuticals were the answer to healthy aging, then the people taking the most pharmaceuticals would be the most healthy and admired. But the people taking the most pharmaceuticals are the dreaded aged that we associate with poor health and function and are really not looking forward to. A metabolic tune-up is not that different from tuning up your car. We clean up the effects of mileage, make old parts run better, and repair the effects of abuse. Running your engine too hard shows up in your labs as stress and inflammation. Stress and inflammation make you age faster, deplete hormones, amplify pain, and increase the risk of diabetes, cancer, heart problems, pretty much everything. Not to worry, doctors in Europe concluded that rhodiola offers comprehensive treatment of chronic stress and stress-related complications. Doctors in Germany concluded that the ingestion of devil's claw results in strong reduction of pain and symptoms of arthritis. If you are achy or stiff, would you try devil's claw? It worked very well for 75 patients in Germany with no significant side effects. Western doctors caution about using herbal medicine. Could cause kidney damage or liver damage or death. Could, but haven't in 3,000 years of recorded use. If nobody has ever been significantly harmed by these medicines, why do you think that they so aggressively warn you not to try them? I can't say for sure, but I'd trust published research that says comprehensive and strong benefits with no significant side effects. I've read thousands of studies on dozens of different plant medicines, and everyone said no significant side effects, even if the plant didn't noticeably improve the condition. So that is worst case scenario. If you take plant medicines that aren't right for your body, you don't notice much of anything. And still, there are reports of people getting sick from herbal medicines that were contaminated. So I wouldn't randomly buy Devil's Claw off the internet. We work with companies that make herbal medicines for doctors, those of us who are open to natural medicine, and test their products extensively. We have amazing resources tested and proven for cleaning up the effects of stress and inflammation. Next, we optimize function. Obviously, we don't replace old parts, but we strengthen what has weakened. Kidney failure begins with kidney struggle. We can see signs of struggle on your labs because we use optimal or healthy ranges. Doesn't that make sense? We don't look at the lab and say, nope, no diseases, you check out fine. We compare you to what is optimal, really healthy, and we hold to the standard of optimal health. Natural medicine made headlines after the '92 Olympics. The Chinese had set several world records and were accused of doping. Nope. All they found was a mushroom discovered by Tibetan herdsmen working at high altitudes. When the herdsmen ate the mushroom, it settled their breathing, somehow improving the efficiency of oxygen consumption from the lower oxygen air. In 2004, scientists determined that cordyceps does in fact increase VO2 max, a measurement of how much oxygen your lungs can consume. Chinese doctors also found 22 studies showing that cordyceps improves kidney function. The kidneys produce erythropoietin, or EPO, which Lance Armstrong was accused of using in synthetic form, a drug, to increase oxygen in his blood and win the Tour de France. It's always healthier to help your body increase production naturally, and that is what plant medicines do. We don't just prescribe turmeric, rhodiola, and cordyceps, though. We run a comprehensive blood lab to test for organ function, gland function, adrenal stress, and systemic inflammation, and give your body exactly what it needs. If you are willing to try these plant medicines, specifically prescribed for your metabolic profile, I can tune up your metabolism. What are you willing to do to avoid being average? Better yet, what would you do to embrace looking and feeling your best? We really owe it to our children to model healthy aging. Let's show them that there is something to look forward to. I have a safe and effective plan. Do you know why doctors say there is no research? They say that the studies weren't big enough. I don't know about you, but even if 5 people took something and it significantly reduced their pain, improved kidney function, or repaired the effects of chronic stress with no significant side effects, I'd be willing to try it. How many people do you think have taken plant medicines worldwide in the last 100 years? 500 years? With no reported deaths or significant side effects. But the recorded history of use is 3,000 years. Even the Bible says, the leaves of the tree shall be thy medicine. Confucius say, real knowledge is to know the extent of one's ignorance. I think it's time to get real ignorant about caring for our health if what we know produces this life, the average American. 78 years of life, 11 of those partially disabled, which means that you are either too weak or too broken to do what you used to be able to do. And for 1 out of 4, that includes remembering your partner's name. If you don't embrace nature for healing, you will probably be an average American. If ancient wisdom isn't enough, why would you listen to Dr. Stone? Just a very quick introduction. My interest in the metabolic tune-up happened after my daughter noticed, Daddy, your boobies are really floppy. She is so dang cute, I could never be mad at her. But it wasn't my favorite observation. I was aware of normal declines with aging, but I was also aware of how poorly we age, on average. And I had helped so many people get stronger and healthier in my clinic, usually from pretty bad places. Melissa was the oldest, best ever in my clinic. Best ever at 70. And she was worst ever when I met her. Couldn't even walk her dog herself. It took a few years to reach best ever, but if you feel your best at 70, wouldn't that remove a whole bunch of worry? I know people in their 60s who do nothing but visit doctors and worry about their health. So, I wondered what normal would look like if I took really good care of myself, like I did Melissa. I've seen hormones increase over 100 points in just a few months. I wasn't starting out that depleted, but I was floppy according to Amory. And I wanted to see, could I get back my younger body? I'm enjoying the best health and fitness ever at 51. And I did it in less than 20 minutes per day, just doing the things I'm going to show you here. What did I do? I prescribed myself plant medicines based on my body needs, just like I did for Melissa, to improve organ function and optimize glandular function, like grains of paradise, which is proven to increase energy expenditure through the activation of brown adipose tissue. Yes, that's fat. And Eleuthero, which is proven to increase exercise-related fat loss. I took the medicines that the Bible suggests. Let the fruit of the trees be thy food, and the leaves thy medicine, based on my metabolic profile, which will determine for you by your lab test. I ate a reasonable diet, 80% whole foods, the whole foods I was most drawn to intuitively, and kept indulgences below 20% of my total calories. I estimated. I moved my body for 10 minutes a day, specific exercise to maximize brain and body stimulation. I started with functional movements, things we might do every day if we worked a physical job. Squat, lunge, push, pull, twisting, bending backwards and forwards. I added movement combinations, primal movements, which are animal movements like the bear and monkey. I added some fun movements like merry-go-round and somersaults. I didn't just do a somersault. I progressed to doing somersaults. Heck, I'm over 50. So I worked on doing this, and then I did a somersault. Everything has a progression. Start where you are and get better every week. More mobile and flexible, which means less pain. Better balance, improved strength. Maybe you'll progress to a handstand. If you have a bad back or knee, you spend your 10 minutes on back exercises or rehab. Pain-free range of motion. If you have no pain-free range of motion, if you can't move at all without hurting more, you need to become a patient of True Health, because that's an inflammation problem. And I did 5 minutes of acupressure daily, like I teach my patients to do for thyroid problems, inflammation problems, but I was doing it proactively, not waiting for a problem. I was doing it to deepen my relaxation and recovery, and to increase my metabolism. My goal wasn't healing a condition. My goal was optimizing my health and fitness. I'm not saying this is the only path to optimal health and fitness, but I doubt you could do it in only 20 minutes a day, 10 minutes of exercise, without the enhancement of plant medicines and acupressure. When you invest in your health, looking and feeling your best at any age, you get a 4-month membership to True Health and can log in and find the exercise routines I did right in my living room for 10 minutes a day, plus acupressure protocols for weight loss, strength, flexibility, plus videos on rehabbing your shoulder or knee or whatever in case you have an old injury like I did. I rehabbed my shoulder using the protocol on the site, and I've not been able to move like this since I was 15 years old. I injured my shoulder lifting weights when I was 16, and I have worked around it ever since, until I followed the steps on that video. I've also got a growing number of healthy recipes that even my kids liked. Man-made recipes, simple to throw together. Currently, the Metabolic Tune-Up is $397 per month for 4 months. You can continue using the membership site after that for $27 a month. The lab itself retails for over $1,700 to get such a comprehensive lab run through your regular doctor. Obviously, we don't pay that, but just to get an idea of what level of testing we are doing. The total investment is a little more than $1,500 over 4 months. When we were fined for not having health insurance, I was quoted over $1,500 for 1 month for coverage that I would still have to pay for, and really no plan to keep my body healthy and functioning as I age. I was still on my own unless something happened. You will not be on your own. I will teach you how to move, take care of your body and mind, clear emotional blocks, eat reasonably and enjoy your healthy meals, and I will teach you the natural laws that Native Americans and traditional Eastern cultures followed. Healthy laws. I also have acupressure protocols for thyroid problems, allergies, PMS, and just about any symptom you can think of. Acupressure typically improves symptoms immediately, sometimes dramatically, but more often you'll see an improvement, and then you just repeat until the symptom is gone. Acupressure has been tested using the scientific method as well, and it is proven safe and effective for treating stress and inflammation and improving organ and body function. I've resolved PMS symptoms in about a minute with acupressure. And nurses reduced post-surgical pain by 50% in a hospital setting. They reported that acupressure significantly reduced the need for pain medications, which significantly increased positive outcomes. That's it. That's what I did to help Melissa feel best ever at 70 and help me get back my younger body, which is actually better than any younger version. Comprehensive diagnostics to identify your weak links and the effects of stress and inflammation. Plant medicines customized to your metabolic profile. You'll get 2 bottles per month, an AM and a PM formula. 10-minute exercise routines designed to maximize stimulation of your brain and body that you can do in your living room. Acupressure protocols to strengthen, heal, resolve nagging symptoms, boost metabolism, and break through emotional blocks to become the best you ever. Easy to throw together, healthy recipes using whole foods that taste good. Daily emails teaching you how to guide your life using natural law. Plus, access to a doctor whenever you need. If you get stuck on anything, just message me and we'll schedule a Zoom session to problem solve. Everything you need to optimize your health, to look and feel your best, and embrace aging, knowing that you understand the laws of nature well enough to age gracefully, body and mind. You can invest in yourself and get a metabolic tune-up by clicking the button below. Or if you have any questions, schedule a free consultation by entering your email and clicking submit. Welcome to True Health. I look forward to getting to know you.